Please make sure to always wear gloves when handling patient specimens. Review of a well-smeared, well-stained peripheral blood specimen is critical to the evaluation of patients with hematologic disorders. The equipment we'll need are 2 clean glass slides, preferably frosted so you'll be able to label them, a specimen of anticoagulated blood. This is usually provided for blood counts in a lavender top tube which has EDTA, which will enter. Pasteur pipette with a bulb on the end of it. You will need to open the blood tube. You are going to place a small drop of blood on the end of the slide just in front of where the frosted area is. A little drop of blood about that size. It's perfect. Put the Pasteur pipette back in the tube. You are then going to take the spreader slide, which is going to be used to make the smear. Stabilize the base slide with your index finger, taking the spreader slide and holding it at about a 30 to 45 degree angle. You're going to bring it back, flush against the bottom slide, and when you reach the drop of blood, you'll see that the drop of blood will start to spread along the bottom of the slide. When it's spread to almost the entire width of the spreader slide, you are going to, in one steady, quick motion, keeping the spreader slide flush against the bottom slide, bring the spreader slide all the way to the end of the bottom slide. We're going to make the slide. The distal portion is known as the feather edge. You can see it's a much thinner area. You want to wait until the slide is completely dry. It takes about 5 minutes. And then after it's stained, the area of the slide that you want to look at to best judge blood morphology is just a bit proximal to the thin area of the feathered edge, right about here, this area here. To stain the peripheral blood smear, you're going to place the slides along a rack over the sinks in the lab room. You are then going to take right stain and completely flood the slide with the right stain. Allow the smear to stain for approximately 10 minutes. A common error is not to put enough stain on the slide. You want to make sure that the slide is completely covered. After the slide is stained for approximately 10 minutes, you want to very gently rinse the stain off with a very gentle stream of water. And let the stain air dry. For about 5 minutes. You can see it. I'm going to demonstrate how to spin a microhematocrit. Hematocrit is the proportion of whole blood that's made up by the red blood cells. You're going to take your tube of anticoagulated blood, take one of the microcapillary tubes, and place it inside the tube, holding the tube at an angle so that the blood will travel up the capillary tube by capillary action. It takes a few minutes. It's not necessary to have the blood go all the way up to the top of the tube, but you want it to at least pass the halfway point. Once the blood has reached about the halfway point, before you remove it from the tube, you want to place your index finger on the top of the tube. And then you want to cap the bottom of the tube by inserting it several times into the clay, which will then cap the bottom. We're then going to spin the capillary tube in a microcentrifuge. You first need to remove the top of the centrifuge. Remembering that this is a centrifuge, you need to make sure that the slots are balanced with capillary tubes. If you put a capillary tube in one side, you need to make sure to balance it with a capillary tube on the second side. Because the tubes are obviously too small to write your names on, each of the slots are numbered, so remember the number in which you've put your tube. Again, this is a centrifuge that works by centrifugal force. Make sure that when you place the tube in the centrifuge, the capped portion, the closed portion of the tube, is facing outside. Otherwise, the blood will all shoot out of the tube when it spins. So you place the capillary tube in the slot. You balance it with another tube containing blood. You can fill up all the slots, as many or as few as you want. Make sure that you close the top of the centrifuge. Otherwise, during spinning, all the tubes will break. Close the top of the centrifuge, lock it, and then spin for approximately 5 minutes. Spin between 2 and 5 minutes. You can use the brake to slow down the centrifuge when it's finished spinning. Unlock and open the centrifuge top when the centrifuge has stopped spinning. Remove the cover. To remove the capillary tube, slide it towards the middle of the centrifuge. Put some pressure on the top and the bottom part will pop up and you can pull it out. What you can see is the column of blood, but now the bottom portion of the column of blood are just packed red blood cells. The top portion is a straw-colored liquid known as plasma. We're going to use this device to measure the hematocrit, which you can actually estimate simply by looking at the column of blood and estimating what proportion the packed red blood cells is of the total blood volume. That's what the hematocrit is. Using this device, you're going to take your microcapillary tube, and with the bottom of the tube, the bottom of the column of blood, touching the black line at the top of the instrument in this little plastic. This is the bottom of the column of blood here. Place the capillary tube in this little slot. You are then going to take the bottom wheel and move it until the red line reads 100. You can stop it for a second. Holding the bottom plate in place, you are going to move the top plate until the spiral line meets the top of the column of plasma, of the column of blood at the top of where the plasma is. And if you're looking at it from this angle, it's even below the line. So, I mean, it doesn't have to be so exact, but if they're just not looking at it at a camera, they're looking this way, just above it, that's right above it, is the top of the line.
Okay, perfect.
Okay.
Okay, perfect.
Okay. Then, moving both plates together, move the spiral line until it reaches the intersection of the red blood cell column and the plasma. The number that you see is the hematocrit. In this case, 43%. Remove the capillary tube, push it forward, and then just grasp it at the end. Remember to dispose of all sharps, including slides, Pasteur pipettes, capillary tubes, needles, of course, in the sharps container.